So commonly, one of the first areas in nearly 90% of everyone's body that it gets really tight and we start to calcify in our fascia is down into our feet and our hands, because they're the furthest away from the diaphragm. If we have had any trauma or surgery onto a certain area, we're also going to be battling with adhesions and scar tissue. The fascia is made up of collagen, elastin, hyaluron, and a water plasma-like substance called H3O2. And like anything in the body, it is always trying to return back to balance. So when we want to create space in the body and look at limiting pain, we really want to work with the adhesions or scar tissue that is in the body to apply pressure to that area, add blood and oxygen, which comes from your diaphragmatic breath and heat, to start to shear through those really thick and dense layers of calcified fascia that have accumulated over time in our bodies. So we're going to start with releasing the feet first. I always recommend doing this against a wall, and I'm using a rubber lacrosse ball to do this. We want to look for pain, so I'm going to be bringing myself to a standing position. Again, you can lean against a wall, and I'm placing the ball onto the underside of the foot. So, of course, we have 4 layers of muscle, 33 joints, and 26 bones in the foot alone. And a lot of the time, we are putting them in a shoe, we are not moving our feet, and they become frozen, stuck, and calcified, meaning that this whole area in our feet and our calves is going to be pulling the whole body in and down, which is going to create pain upstream in the body. So we're going to be spending about 3 minutes not rolling the ball, search for a place of pain, stay there, diaphragmatic breathe. So we want to be breathing in through the nose, feeling the belly expand, looks like this. And out through the nose, the belly pulls to the spine. In through the nose, the belly expands for 4. And out through the nose, the belly expands for 6. Now I'm staying onto that area that is painful, and I'm doing the best I can to relax my nervous system while staying here for 3 minutes. This starts to get into those calcified layers of fascia, again more build-ups or migration of collagen without the elastin that have migrated there over time, as in many, many years of patterning of our bodies, to start to again create heat and energy and blood flow into the area so that we have better movement in our feet, our ankles and our calves, creating less tension upstream in the body.